And welcome to the Mom and Mind podcast. I'm your host, Dr. Kat. And on this episode, I am joined by Talia Nepper. She is a 32-year-old proud mom of two young children and a passionate artist whose creative journey has been a vital part of her healing. Talia's path through motherhood was shaped by her experiences with postpartum depression, anxiety, OCD, and rage across two postpartum periods. Although those challenges were very difficult for her, that led her to discover the transformative power of art therapy, trauma therapy, and support of the local postpartum groups, family, and friends. Through her healing, she found resilience and has become an outspoken advocate. Recently, Talia embraced her identity within the LGBTQ plus community, further expanding her sense of self. And now Talia is the author of Unveiling Motherhood, Poems of Postpartum Resilience, a collection of poetry and artwork that reflects her raw and honest experiences with pregnancy, birth, and the often overlooked realities of postpartum life. And on today's episode, she's going to talk to us about the two extremely traumatic births she experienced, her pregnancies, postpartum experiences, and how art became her saving grace. And then how that led her to her book that she published this year about her postpartum journey. So let's meet Talia. Welcome, Talia. Thank you for being here.
Hi, thank you so much for having me.
I am happy that you're sharing your experience with us today, although I know it was a difficult one, as are many of these people's experiences through this perinatal mental health difficulties. But when you've had repeated experiences, it just adds so many other layers of complexity. So I invite you to start wherever you'd like with your story.
Sure. I will just start by saying that I do have two children, so two pregnancy and birth experiences. My kids are not certainly not grown, but still young, 3 and 5. And so my son is named Liam and my daughter is Luna. It just might be easier as I'm going through their pregnancy and birth stories to
Sure.
refer to them by name. But I guess I'll just give a little bit of background. I just throwing this out there, I myself have some health issues and have for a really long time. And so I didn't even think that I could get pregnant, very honestly. And so Liam was very much wanted. So back in 2018, again, my husband at the time, we didn't think that I could get pregnant. And so Liam was a beautiful, wonderful surprise. And as soon as I found out, the doctor that I was working with really put a damper on our pregnancy.
Mm.
She said, "You should keep your expectations in check. It would be a miracle if you and or the baby survive."
What? Okay.
Yeah,
That's
that's how
why?
I have so many health issues going
Okay.
on
Okay.
and lots of autoimmune issues.
Mm.
And again, we didn't think I could get pregnant. And
Right.
but that's really how I started my pregnancy. Just out of this place of fear and, oh my God, am I gonna survive? Is the baby gonna survive? And I'll tell you, that's not a great way to start a pregnancy.
Not at all. Not at
No.
all.
So, from someone who already has a very anxious brain, that's just really where I live. I was just scared that anything and everything was going to either be detrimental to me, be detrimental to Liam. And so I was, yeah, I understand why that doctor said that. I really have a lot of resentment about that, but
Mhm.
get it. But that whole pregnancy, I just fear after fear, like I figured I was just worried that if the slightest thing went wrong, that poof, baby was going to be gone.
Mm.
I don't mean to say that so lightly. That was just my fear.
Yeah.
And it also didn't help that I was like almost as soon as I found out I was sick the entire
Oh
pregnancy.
gosh.
Nausea, vomiting, very sick the entire pregnancy. So I knew because of my health issues that I would probably do better having a scheduled C-section. My ex at the time did not agree. He thought like natural was better. He was really pushing for me to have a natural birth. I was scared out of my mind
Mm.
to to attempt that. Just
Mhm.
really knowing my body, knowing my limitations, and also just still having this in the back of my mind, "Oh god, I don't know if I can survive that." Yes. So anyway, I think I was about 28 weeks. I had been going the typical route, like OB in a hospital setting. And after being really like pushed to go the natural way, we switched. We went to a birth center, signed up with a midwife, and I will say the midwife was very kind, very loving, very, very caring. And I dove headfirst like into hypnobirthing
Mhm.
and just really trying to set my expectations for a beautiful birth. I don't think it ever worked for me. It's not that I wasn't it wasn't that I wasn't giving it my best shot. I just had such profound fear. I don't know
Mhm.
if it was a knowing or just a feeling or what, but it was just this fear for me. And so as my very difficult pregnancy continued, the baby I was growing, Liam, was very
Oh,
big. And so we hit 40 weeks. He was not planning on coming out anytime soon. We continued. By that point, I had stopped working at 38 weeks. I could barely move. I could barely walk. I was in so
right.
much pain. We thought he was coming early. No, he definitely wasn't. We got to 41 weeks. We're still waiting. And I really wish hindsight is 2020, but I really wish the midwives had said, "We need to get you to the hospital. This is a really big baby. You're not doing well. You should be induced," whatnot. I rolled all the way around to 42 weeks. And the day before 42 weeks, they did all of like, their last efforts.
Okay. Uh-huh. Oh, yeah.
Yeah, all of the painful things to me, they were really painful. And that morning, I did go into labor, and for the first hour, I would say it's maybe what you would consider to be an a normal labor, what
Mhm.
you would read about, like, you have contractions that are spread apart, and they weren't awful contractions. I was able to breathe through them, things like that. And the birth center was about 40 minutes from our house, so we drove there just wanting to make sure I was actually in labor. But pretty much as soon as I got there, things really took a turn. We've speculated of why. The midwife said she thought it was probably my son's size, just and positioning. But basically, what started happening was I started having contractions one on top of the other, like right from the start. This
Oh,
is only an hour in,
yeah.
and they were not like gentle contractions. They were like excruciating, painful contractions right out of the gate.
Yeah.
So I was brought to one of the birthing rooms, and I consider myself to have a very high pain tolerance, and I was not doing well. But
Mhm.
I really like this sounds so terrible when it comes to birthing a child. I gave it the old college try.
Uh-huh.
That sounds so terrible, but like I really gave it my best shot, but I was not doing well. And so I birthed, I think from 10 a.m. to about 10:30 at night. And I had progressed all the way to 7 centimeters. And then because I was just like in so much distress, I actually started swelling and I went all the way back down to 5 centimeters.
Oh,
And
okay.
so at this point, I'm just like, I'm a mess. I
Of
haven't had,
course.
it has literally been one on top of the other, no break.
It's a
And
lot.
yeah, at this point, I'm saying, I think I need to go to the hospital.
Mhm.
I really need a break. I can't keep going.
Yep.
And the midwives, again, I know they're trying to be encouraging. They're saying, "We think you can do it. You can keep going." And I'm like, "No."
It just in listening to this, it's striking that there's some part of yourself that well, a lot of yourself that you know what your
Right.
body's telling you, and you knew that from the beginning. And
Exactly.
I hear what you're saying that like people around you are trying to be encouraging and give you, but also at some point, just listen to the person who's birthing should
Right.
have they have the first say and last say that know your body. And especially because what I find to be true is people who do have any kind of chronic condition, autoimmune stuff, have had to learn to deal with a lot of discomfort in their life. So like you can push through a lot of stuff,
Exactly.
but that doesn't mean you should.
Mm.
I
This is
wish.
the start
Oh,
of
okay. Yep.
the awful birth,
Got it.
being
Uh-huh.
honest. After them really, like, pushing back, "No, I should keep going there," they finally agree that I can be transported to the hospital, but they want me to be transported to a hospital with midwives because they don't want any interventions for me. At this point, I'm like, "I need the interventions,
Yeah.
I need." I
Oh boy.
yeah. So we drive 30 minutes to a hospital with midwives. Awful drive. We get there, and the first thing we find out is that I have an infection. I don't remember the full name, but I have polio. Baby baby baby's waste was basically inside me, and I was infected. Baby is not doing well. Baby's heart rate is dropping. I'm not doing well. They give me oh, wow. Sorry. They gave me an epidural, and it does start helping with the pain. From this point on, though, because I have the infection, I start shaking tremendously. And I know there are other reasons that people shake during birth as well,
Yeah.
but this starts going on. So we're going through the night. At this point, I'm like so incredibly dehydrated. My fever is getting worse. They're just pretending like nothing is going on. It's a very weird thing. They're not checking on me. They're still just saying, "Oh, you're doing okay. Baby's doing fine."
But
You're
you're clearly not, I assume you're clearly not okay. And there
I'm
are
clear
signs that baby's not also not okay.
occasionally they'd readjust me. Yeah.
Ugh.
So by about 6 in the morning, I have started losing all function. I can't speak, I can't move, I can barely mumble. And so I'm like the only words that I can get out are I need I and I'm sorry if this is triggering to anyone, but I'm saying I need you to take him out or I'm going to die. I'm at that point. I need you
Mhm.
to take him out or I'm going to die. Those are the only words I can repeat. And they think that I'm just in transition. They come check me. I'm at like 9 centimeters. They think I'm in transition. They think that's why I'm saying that. They think I'm being over dramatic. I'm not. And so after about 2.5 hours of this, I finally look at my mom and I said, "They're not listening to me. You
Mhm.
have to take him out or I'm going to die." So then it's this big flurry. Doctors come in, and at this point, this is so ridiculous to me at this point. They're still having me try to sign a paper to
What?
yes,
Oh
like
my
I can't
gosh.
do anything at this point. They're having me try to sign to say, yes, it's okay to have the C-section. I'm like, I can't do anything at this point. So they roll me into the C-section, like the operating room. And at this point, I'm in and out of it. I'm seeing flashes of things, but I'm not all there. So
Mhm.
from this point, I only have flashes of memory. I know I got in there and I didn't know that my husband wasn't coming in with me. So I'm looking around. All I see are doctors, and I'm like, where's my husband? I'm like calling out for him.
Right.
Nobody's responding. Nobody's
Right.
telling me anything. So from that point, and this is where it gets really hard, I did not see my son born. Mm. They also had a very hard time getting him out.
Mm.
He ended up being 10 pounds, 5 ounces,
Mm.
and he was 23 inches long,
Oh my gosh.
and he was very stuck.
Yeah.
Yeah, they couldn't get him out, and I don't that shaking that I was talking about, that got even worse in surgery,
Uh-huh.
but one of the first things that I remember hearing in that operating room is that I'm septic. I'm yes. So I wasn't able to function because I was that far filled
Yeah.
with infection.
Oh
I
my
also
gosh.
hemorrhaged very badly in that operating room. So I I have a picture there are pictures of me, like, in the operating room, and they're so painful for me because, again, I only remember flashes. Like, they
Mhm.
brought baby over to me to kiss him, and then he was taken away, and I don't remember anything else
Mhm.
until I'm in the recovery room. I was there for 5 hours. Again, I'm seeing, like I can only open my eyes once in a while and see my son, and every time my husband at the time would be like, "Do you wanna see him?" And then I was out again. I couldn't come to long enough to see my infection was getting worse. They start pumping me full of meds,
Yeah.
like, it was just really bad. So I didn't hold my son until about 6 hours after birth, and I have this picture of me holding him for the first time that I do not remember.
It's
But if you
painful.
look at me, I'm smiling, but I you would never guess that it was me. It doesn't eh,
Like you're
it
not there.
yeah,
There
and
but
it
not there.
it looks truly like I went through, like, a car crash, and I'm just, like not that I look
Mhm.
like that
No, yeah, I understand.
one of them, but I'm just vacant, and then I remember coming back to the room, and the midwife was still there from the birth center. And I remember them immediately pushing breastfeeding on, and I'm like, "I just came from almost dying. I have nothing to give a baby right now."
All right.
And it didn't work, of course, and they were like, "Oh, you can try again later." So that and I'll just, like, very briefly say the hospital stay that I had after that was horrendous. I don't know how much detail you want me to go into because I don't want to take too much time talking about that, but it was really horrendous. People were not reading my chart and making me do things like get up and walk on my own far before I was even supposed to be out of
Oh,
bed. Like,
wow.
yeah, it was just a
Oh,
really
that's
stressful.
horrible.
Yeah. So I ended up being in the hospital for a week, and then I went to the birth center for kind of a breastfeeding boot camp because I had gotten no breastfeeding help at all
Oh,
while I was in
okay.
the hospital. So yeah, that was my first pregnancy and birthing experience with Liam.
There's so many points along your story that it could be traumatizing or potentially were for you that were missed or overlooked entirely, it sounds, by
Absolutely.
any number of people.
Yeah,
Which for anybody who goes through something like that, not being seen and heard and understood is already a horrible feeling.
it is. It
Right?
is.
And then you're also having all of these other very real traumas on top of it.
And I think what made it even worse for me is I'm already a trauma survivor in my past. And one thing I really had to figure out was I had very bad postpartum depression, and I had to figure out, like, why does it feel like it's not just the trauma of the birth that I'm dealing with?
Yes.
And
Yes.
I had started working with a therapist, and it was like, oh no, it was like pulling up all of the trauma from the
Hmm.
past. And now I'm like, why am I thinking about that thing from 13 years ago?
Here
It's
it is.
cumulative, it's one on top of the other.
Yes. And with something as for some people, you don't even have to have all of that trauma to bring up trauma from the past. But when you do, it's like it flips on all these switches to remember so much stuff. You're vulnerable. You are now also in charge of taking care of this little being and all this like comparison of I never want anything bad to happen to them, happen to me. It's
Mm,
such a mind
yes,
fuck. I'm gonna,
completely.
that's our technical term for today.
Yeah, I'm good. Mindfuck. I will also say that the way that things happened really prevented me from feeling that bond with
Yeah.
Liam
Yeah.
right away. Maybe to others this sounds silly, but because I didn't see him be born, I had this really hard time like believing that he was mine. I didn't see him, so I'm like,
Hmm.
"That's actually my baby." What a weird thing to
Hmm.
experience when you just birthed the baby, but it took me 9 months to actually form a real connection with him.
Yeah.
It wasn't that I didn't love him.
Right.
I loved him, but actually feeling, like, close to
Mhm.
him, it took a long time
Right.
to really bond with him.
How long into postpartum did you get into therapy af- after postpartum?
It was pretty much right away. I would say within the week, I had started seeing someone, and the first person I saw was not a good fit at all. It's like a read the room sort of thing. She was I have this new baby. I'm totally overwhelmed. She's here. Read this article and this one, and I'm
Yeah,
like,
no, we're not reading.
oh, I don't have time to read. I ended up meeting my art therapist about, I think it was about a month and a half after I had Liam,
Mm,
and I had no idea that she would be the kind of the person who saved my life in those early days.
I'm so glad you found that therapist.
Thank you.
It is so important to find a good match.
It is.
Um, what was it about art therapy specifically for you that was helpful?
It's interesting. So there's a group in Wisconsin called Mom's Mental Health Initiative
Mm,
for all. Have you heard of them?
yes.
Yeah, they were also extremely helpful to my survival in the early days. But they had they have a network of providers who
Mm,
are specifically, how would you describe it? They're specifically they're providers who have worked with people who have dealt with birth trauma
mhm,
or perinatal mood disorders or things like that. And so they connected me with my therapist. And I remember looking at this person's card saying art therapy, and I was like, oh, fuck this.
not your thing. So you
No,
thought,
I'm such a perfectionist, and I had always hated doing art because I couldn't make it perfect.
yeah,
And so I had this phone conversation with my therapist before I ever met her. And I said, "I don't think this is gonna be a match for me. I don't even do art because I can't get it perfect, and I'm really worried that I'm gonna be so frustrated in sessions trying
mhm,
to do art that I won't even make any progress, like, mental health-wise." And so we had this long conversation about how she just she thought we would be a really good match. She shared a little bit about her birth story. Not a lot, but enough to know that I'm like,
mhm.
"Oh, this is a really kind, caring person."
Nice. Yeah.
Even if we don't do art, I can still talk to this person. And when I got into art therapy, what ended up happening was, at first I tried to do like the perfect it should look like this, and then it started being about like, oh, it doesn't have to look like anything. It can be I'm painting what I'm feeling.
Mm,
And so a lot of my works became really abstract.
nice.
And it became this hugely unexpected blessing.
That's great. That's
Yeah.
awesome. And I know that from your experience, at what point did you realize or figure out that postpartum depression and anxiety and OCD and also postpartum rage were part of what you were experiencing?
I really didn't understand it until I started working with my therapist. I just thought that I was failing. And I thought there was something wrong with me. At that point, I was still trying to breastfeed. It was going terribly.
Mm,
I was getting a lot of pressure to continue breastfeeding. I was just still recovering terribly from my surgery and all of those things. I'm just like, I remember like writing like my baby would be better with a different mom. And I is that true? No. But I couldn't figure out why like, being so hard on myself, like, why I couldn't get it together and why I was so angry all the time, and
mm,
I couldn't figure it out, really, until I started working with my therapist, and she started saying, "There's nothing wrong with you. That's what this is. That's postpartum depression. That's
Hmm.
postpartum anxiety. The reason that you're so angry, that's postpartum rage. That's
Hmm.
something that's not talked about a lot." Those conversations started happening, and I was like, "Oh, I'm just struggling, or I'm
Hmm.
not broken."
Right. Given what you've been through, just with pregnancy and birth and postpartum, and then given whatever it was that you'd been through previously in life, and all that being like kicked up again, of course you're feeling all of this. There's just so many things, but what's so hard about going through it is that you're just so in it that there isn't, you can't gain perspective that, oh, of course I feel this way because of all of that I've been through. And that's like the power of having that external person who's caring and supportive to help you gain perspective.
Absolutely. I think the other thing though was even when I heard that initially, I was still too in the depths of it to
Hmm.
even take that in and have that make a difference. It was like, okay, I'm having postpartum depression. I'm still a failure because I had put so much pressure on myself to have a natural birth, to have it go
Hmm.
a certain way. There was still this failure mentality, this shame mentality.
So all of what you've described so far, and of course we're not getting the full story. It was with the first pregnancy and postpartum, but I think the second one was also difficult. Was it difficult in the same way or difficult in a different way?
Difficult in a different way. I can give like a brief synopsis if that
Hmm.
would help.
Yeah.
With my daughter Luna, I was definitely not ready to be pregnant with her. In fact, after Liam, I never wanted to be pregnant again.
Uh-huh. Yep.
Pardon me. And so I got pregnant with her 9 months postpartum. Yeah. Yeah, she was a surprise and I was not ready.
Okay.
And I also had a very awful pregnancy with her, even worse than Liam and how sick I was. I had
Mm.
hyperemesis and I was puking 20, 30 times a day.
Oh
I
no.
was just so sick. Um, and I, of course, not her fault, but I had so much resentment for being pregnant because
Hmm.
I just never wanted that again. You talk about connection with the baby inside. That was not a thing for me when I was going through that pregnancy. It was
Hmm.
just so hard. And I had a planned C-section this time. We were
Not
not taking
messing with that. Yep.
chances. The second C-section for me was scary for me in a lot of different ways. There were still things about that C-section that were horribly frightening. I was very much awake for that one,
Mm.
and things that they don't necessarily talk about all the time. Like I had a spinal block that time. One of the things they don't talk about is you can't feel yourself breathing when you get that spinal block. So I
Mm.
was convinced I could not breathe, panicking and
Oh gosh, what a
so
bizarre sensation.
very bizarre. Clearly, I'm still alive, and the
Hmm.
anesthesiologist is you're breathing, and I'm like, but I can't feel it.
Yeah.
That time I was able to see Luna born, and so that was really special. However, that time I also hemorrhaged really badly. I lost a lot of blood. I, again, didn't get to hold Luna for like the first hour of her life because I was just losing so much blood. They almost had to bring me back to the operating room. Just very scary. I would say not as bad as Liam's birth, certainly different, but still scary. And the way that it manifested afterwards for me with her was very different. It wasn't necessarily, I did have some postpartum depression, but with her, it was far more postpartum anxiety. I
Mm.
was just constantly worried about something bad happening to her.
Mm.
It's interesting how they were
Right.
different for
Right.
each kid.
Oh,
Yeah.
right. Yep. Oof. Okay. You were not done in your process of healing and figuring stuff out before you had to before all this other stuff got layered on.
Oh gosh, no.
Did so the depression, anxiety, OCD, rage was all up and present again?
The one thing I didn't feel with her was rage. Was really that was just starting to simmer down. with Liam, because really right around 9 months was when I started to bond with him and feel
Mm, mm.
like comfortable with him. And then I got pregnant with her right at that same time, and it was just like, no, I was just starting to figure this out.
Yeah.
So yeah, some of that died down, and then others with her just ramped right back up.
So in your process, going back to some of your own healing journey and you doing art, how did all of that get worked into becoming a book, becoming your, which I assume was also part of your healing process?
Mhm. So in the book, it does have pictures of the art that I've made, but writing has also been extremely important to me. Writing has been a way that I can express myself, and it's personal to me, but it is also a way that I've shared my story a little bit over time, and it's an outlet for me. And I think during my time of postpartum depression, anxiety, all of that, I felt very alone.
Mm,
And the writing this book was if I could even help just a couple other people feel like they weren't alone, if any of these things were things they could relate to,
mhm.
that was all I hoped for with this book. I don't know if I don't know if that has actually happened or not, but that was the hope with this book.
And is it mostly poetry? Is it story form? Is it what, in what way did you write?
Yeah, it's mostly poetry. There's a mix of rhymed poetry and just kind of straight form poetry. And it goes through my journey from pregnancy all the way through making it out of my postpartum depression
Mm,
and really into kind of enjoying my kids and being in a better place as a mom. So,
that's amazing.
thank you.
Yeah, it's this. People's stories are always so amazing to me because a lot of people don't see how they're going to be able to feel better when they're in their deepest, darkest times. It's
Yeah,
nearly impossible to hold that, yeah, I'll probably feel better at some point, even though I have no idea how that's going to happen. And
I
then,
certainly,
no,
yeah. And
right.
what were you gonna say? I'm so sorry I didn't.
Oh, no, and that the healing process like just reveals itself as you're doing it. It's you don't know ahead of time how you're going to feel in 9 months or whatever the time length is, and it takes a lot to continue on that path even when you don't know how it's going to go.
Yes. And I think the other thing is in society, we have this idea that you can deal with this for a little bit, but then you got to get back. And it is each timeline is so different. There is no, oh, 2 months, you got to be back to feeling great.
Yeah,
It doesn't work
that's
like
not a
that.
thing.
It takes time. This book I just wrote last year, and that's obviously several years past my kid's birth.
Hmm.
The amount of healing that came with it was immense, but I wasn't ready for it until this last year. The art that I have done has been a real journey, but I haven't been ready to face some of the birth trauma and postpartum things until just a couple years ago, this last year.
Right.
I think everyone's journey is really different, and it's not a shameful thing to be stuck in that darkness. It it's a really painful thing, but not a shameful thing.
That's yeah, beautifully said. You're absolutely right. And I know your hope is for other people to know that they can make their way out of times like what you experienced or whatever their experience was in that darkness.
Absolutely.
Okay, so throughout your journey, looking back on it now, how do you think that therapy and art therapy specifically helped you to heal?
I will say hands down it saved my life, truly. When I was in the darkest of the dark times, I didn't want to be around, and I genuinely thought my kids would be better off without me there, which I can tell you is not true. And I know a lot of new parents, new moms feel that way, but therapy has allowed me to Therapy has allowed me to be seen in a way that I never have. Therapy has allowed me to be heard in a way that I never have. And I think that I believed before I started therapy that I didn't deserve.
Oof. Yeah.
Yeah. And over time, I think they have not necessarily that I needed someone's permission, but they have gradually given me permission. Please share what is in your heart.
Mm.
Share what is feeling hard. Share what you don't feel like you can share with anyone else. Like they have just opened their hands. Here, you can share it all, and I will be here to catch it. And
That's
that has been
beautiful.
the most invaluable gift I could have been given.
That is beautiful. I'm so happy for you. I'm
Oh,
so happy that you got that bit of healing. It is unbelievable how important that is to be seen and heard.
absolutely
I think it's some of the most important stuff.
agree.
I'm so glad you got that.
Thank you.
Yeah. And I'm really grateful that you came to share your story with us and talk about all of that. It's hard to revisit. It's hard that you went through it and I'm grateful that you've been able to put your experience into a form that can also help other people.
Thank you very much. Thank you so much for having me today and for allowing me to talk through this. I think I mentioned to you before we started talking that it's not always been possible for me to talk through it like this. Years ago when it first happened, I couldn't get through it without sobbing and crying. So
Of
there's been
course.
a lot of work done, but I just so appreciate that you have given me a space to talk about it, and I'm really grateful for that.
I'm happy to. Alrighty. Thank you again for coming on.
Thank you. You too.
You can find Talia's book, Unveiling Motherhood Poems of Postpartum Resilience, on Amazon. You can check her out on Instagram at the PTSD Poet or at luli.studios. And please make sure you're subscribed and following the Mom and Mind podcast on your favorite podcast platform. I really appreciate you being here with us and hearing these stories and bearing witness to the things that these folks have gone through. It's so important and it's so healing for all of us to know that, man, there's a lot of stuff that can happen to us, and there's also so many ways that we can heal and make it through. So, thanks so much for being here. Until next time.